Hi, everybody. Welcome to today's session of Community Table Fair Housing Issues Impacting Homelessness. We've got several folks from the Kentucky Fair Housing Council here today, and I will let them introduce themselves. If you have a question or a comment, you could use the chat or raise your hand feature, and somebody will bring that up and read that or unmute you and let you speak. So I'm just going to turn it over to our presenters here and let them do their thing.
Hi, this is Carrie Lewis. I'm the Assistant Director over at Kentucky Fair Housing Council. Today I have with me Annie Renner. She is our Programs Coordinator, Intake Coordinator over here at the Kentucky Fair Housing Council. And then in the background, you can't really see him, but we also have Noel Wallace. He is our AmeriCorps member who does a lot of our intake calls as well. So we're going to go over some fair housing issues and that impact homelessness. So today's agenda, we did our introductions. We're going to talk about what we do over here at Kentucky Fair Housing Council. We're going to give you a little bit of background information on the Fair Housing Act, and then some homelessness and housing access issues, and then how that fair housing and the homelessness intersect. And then we'll have some questions at the end. And hopefully by the end of the session, you'll just have a little bit of a better understanding of the federal housing protections and the systemic barriers that make it hard for unhoused individuals to secure stable housing. So who we are a full-service nonprofit civil rights agency committed to eradicating discrimination in housing. The Fair Housing Council enforces the Federal Fair Housing Act, the Kentucky Fair Housing Act, and the local fair housing ordinance where applicable. And I'll go over some extra ones that we have in Louisville. And then the Kentucky Fair Housing Council is the only private nonprofit fair housing agency in Kentucky, and we investigate complaints throughout the Commonwealth. So our services, like I said, we serve the entire state of Kentucky. We investigate claims of housing discrimination. We have free legal representation and advocacy. So we have 2 attorneys on staff right now. And then we do training and outreach for the community on fair housing protection. And then we do a discrimination testing program, which I run. And what that is basically we send in secret shoppers to just gather information from different rental agencies to see if anybody's being treated differently based on a protected class. And so the Fair Housing Act of 1968, Martin Luther King Jr. said at his 1964 Nobel Peace Prize address, almost 2/3 of the peoples of the world go to bed hungry at night. They're undernourished, ill-housed, and shabbily clad. So I think that ties in great with the conversation that we're having today. And we're going to talk about why fair housing matters. So it's more than just a law. It's about fairness, opportunity, dignity, and everyone deserves that safe, affordable place to call home where they're free from discrimination. And why it matters is, one, it protects people. It builds stronger and more inclusive communities. It expands on that opportunity, and it breaks down the barriers that we have, and then it promotes that stability. So with all those things, when someone has a house, all things start to come together in life. Like, you feel safer, you feel more stable, you feel more productive, you feel part of a community. Without those things, you feel like you don't matter. And we're going to have later on, I have a video for you guys from someone who is homeless. So what is fair housing? Fair housing is the right to choose housing free from unlawful discrimination based on a protected class under those federal, state, and local housing laws. And then fair housing protects against discrimination in any housing transaction that includes rental, sales, lending, and insurance. And it also includes that differential treatment in terms and conditions, as well as prohibiting retaliation or coercive actions. So then the protected classes. In 1968, President Johnson signed the Fair Housing Act of 1968, which included, I didn't even put the ones in there. Oh my gosh, it included national origin, religion. Annie, help me out.
Race and color was
Race and
included
color.
in the original one as well.
Yeah, I don't know why I don't have that in there. And then in 74, Ford amended it to include the basis of sex for discrimination. And then Reagan amended it again In 88 to add that familial status and disability. And then in 2020, we saw that Bostock versus Clayton County, which expanded that definition of sex to include gender identity and sexual orientation. So then the types of properties covered: single family homes, condos and apartments, mobile homes, homeless and domestic violence shelter, nursing homes, student housing, which includes your university dorms, and then rooms for rent. So some basic prohibited classes are refusing to rent or sell housing, falsely stating that housing is unavailable, offering those different terms and conditions, which could mean someone with a wheelchair gets charged a higher deposit because they might be afraid they're going to ruin the carpet. And then that discriminatory advertising, no small children, and then intimidation and harassment. So then to get you guys thinking about fair housing and homelessness and how it can all tie in together, I do have a little case study that I want you guys to kind of participate in. You can answer in the chat or just answer, put your hand up if you want to speak. So the first case study is Maria Lopez is a 30-year-old woman diagnosed with bipolar disorder, a mental health condition that she manages successfully with medication and regular therapy. She receives a housing voucher and is looking to rent a quiet studio apartment close to her support services. She finds a listing for a studio unit in a small apartment complex owned by Mr. Green and calls to set up a tour. During their conversation, Maria mentions that she receives disability benefits and participates in a local mental health support program. So the events. After showing up, Maria asks about policies on quiet hours and whether there is a place nearby for her dog and emotional support animal to go outside. Mr. Green becomes noticeably uncomfortable and says, to be honest, I've had problems in the past with people who have mental issues. They tend to cause drama. I don't want to deal with that. Maria replies calmly, I've never had an issue with any landlords. My condition is stable and well managed. I'd be happy to provide documentation for my service animal as well. Mr. Green says, I just don't think this is the place. This place is a good fit for you, and ends the conversation. A week later, the same unit is still listed available online. So as you guys listen to that, what were some key things that you were hearing that were right, were wrong? Does anybody have any comments on what I just read through? No one? So basically, we don't want to see Mr. Green, one, say there's going to be problems with people with mental illness. That's discrimination based on a disability. So Maria would call our organization and we would reach out. Yes, you can't refuse due to mental health. And she also has documentation. She's saying, look, I go to therapy. I can provide these things for you. Those are things we want to see that landlord interact with her about and have that interactive process to get her the place that she needs to live. Without that stable home, Maria is going to be homeless. So, homelessness and housing access. So here's a little short video that I pulled from someone living on Skid Row. That's a very good listen.
Skid Row hurt me in ways I can't ever explain. It made me do things, it made me see things that I wish I never would have seen. It's amazing what people can do to other people.
You're gonna have to, I can't hear you with the traffic.
It's amazing what people can do to other people. I especially feel bad for the females here. They get used up in a whole different way. My wife experienced that. But ultimately, I've seen some great acts of kindness here. I've seen some great things. The problem is you get trapped here. And people say, I panhandle for money. People say, get a job. Okay, well, if I had somewhere to rest my head where my stuff wasn't stolen, where I didn't have to worry about blankets, where I didn't have to worry about food, I might be able to get a job. But then also, I've been seen through this entire town now, and now I'm known as homeless. So to get a job, I have to leave the area.
So that was a very good key point he made. Why don't you just get a job? Well, if he has a job, then now he has to leave all his belongings somewhere. He doesn't have a home to put them in. He doesn't have a lockbox. He doesn't have any safe place to put that. So in his mind or their mind, why would I give up what I do own for that specific thing? And so it's a battle that they fight, and that we need to be more compassionate, and we need to have more resources for people going through this. So we'll go to the next one. So fair housing protections. So while Fair Housing Act prohibits discrimination based on those race, color, religion, sex, national origin, familial status, and disability, it doesn't explicitly protect individuals experiencing homelessness. However, many homeless individuals face discrimination based on disability, race, familial status. So we have to look at those key factors as well. So then HUD defines homelessness as a person who lacks a fixed, regular, and adequate nighttime residence. So primary causes of those can be poverty, unemployment, lack of affordable housing. We said those mental health issues, substance abuse, and domestic violence can also be part of homelessness. And then that systemic racism and discrimination that we see. So how they intersect, there's barriers to housing, right? There's the poor credit history, evictions, and criminal records. So what can we do differently? We can look at arrests versus convictions. We don't want to look at those arrests. We want to only look at convictions. And then we want to have policies and procedures in place stating possibly maybe one complex says, 7 years for this type of conviction, and we'll do this, and we won't look at this. Or, there's certain things that they need to have in their policies that just aren't baked in, saying, we won't look at anyone with arrests. We won't look at anyone with convictions. We need to keep an open mind and look at those convictions and look at those arrests and make determinations based on that. And then also we can see letters of recommendation from those sober livings, mental health professionals, shelters, or case managers. And then that lack of income documentation, rental history, or source of income, we can look at letters of recommendation again for sober living and health professionals and those shelters and case managers. And then part of that source of income is landlords refusing to accept housing vouchers or subsidies. Well, we want to see them start looking at other sources of income, such as those vouchers, Social Security, or rentals assistance. And then we also see that not in my backyard attitude. And then some of the impacts that we see are disproportionate impacts on the LGBTQ youth, the Black and Indigenous people, veterans, and survivors of violence. So that's something we need to be on the lookout for. So then some numbers that impact us in Kentucky. We have Lexington, 925 people experiencing literal homelessness, sheltered or street. 32% increase since 2020. That's up 100 people since 2024. And only 498 shelter beds are available. That is not enough to meet our demand. And then the key barriers, again, are lack of family shelters, the inaccessibility for elderly or LGBTQ individuals, and that overcapacity. So the barriers that we look at for elderly would be the disability sections. We see a lot of shelters that don't have accessibility for people with disabilities. So expanding shelters with people with disabilities is a must. And that overcapacity, families with shelters, again, or lack thereof. Here in Lexington, EHI consultants recommended building a lower barrier emergency shelter with on-site services such as mental health and transitional housing. And Mayor Gorton forms a homelessness task to force the act on that report itself. So then this is Louisville. So Louisville saw a 41% increase between 2018 and 2021, and 1,728 individuals are unhoused in Jefferson County. And that's from a January 2025 point in time count. And then of that 1,728, 595 of those individuals are living unsheltered. And so we see in Louisville, they have other protected classes. These are these local ordinances I was talking about. Protected classes include the source of income, criminal background, homelessness, and veteran status. So we can't discriminate just because someone's homeless. And then Louisville did enact this homeless court or unlawful camping docket, and it was established to for the criminalization of homelessness through the Safer Kentucky Act which created the offense of unlawful camping. But this court aims to connect individuals with those resources that they need so that they can get out of those encampments. So then some final thoughts I want you guys to think about are what challenges might someone face who is homeless, even if they qualify for housing assistance, and then how can local policies and community initiatives support the intersection of fair housing and homelessness? And then that's basically it. There's all my contact information. This is how you spell my name. Does anybody have any questions or anything to add or what they see in their areas?
Carrie, would you talk a little bit about the emotional support animals? I know
I
that's
sure
a
will. So
Okay.
emotional support animals are different than pets, right? There's two different key categories that make them different. The first one is an emotional support animal serves a purpose for someone with a mental disability, and it alleviates a symptom. So you can't charge pet deposits or pet fees for emotional support animals, and you can't do like breed restrictions or any type of restriction. They're allowed to have, if they want a snake, they can have a snake. If they want a dog, they can have a dog. If they want a dog and a cat, they can have a dog and a cat. So the policies are, you can treat them just like a pet when it comes to damages done. You can make them clean up after their emotional support animal. They do have to clean up feces. You can make them turn in vaccination records, having a letter from a licensed doctor that they speak with that can verify that their emotional support animal is alleviating a symptom. Annie, what else can you think of?
Something that I'm thinking of, in the context potentially of homeless shelters, is that you can require that somebody cares for the animal adequately. So I'm thinking in the case, like Carrie mentioned, let's say you do have somebody who walks into a shelter and they say, "This is my emotional support snake." Well, emotional support snake is held loose, kept in a pocket, not provided with adequate heat and light that those reptiles require. You can say, okay, you're not providing adequate care for this animal. I need you to either provide adequate care or this animal is not going to be allowed. And the question really quick, I'll answer, Carrie. Can a therapist or a case manager write a letter if there is no doctor? If you are a licensed professional, you are allowed to write a emotional support animal letter or a prescription letter, basically. You just have to be somebody who has a history of providing care to that person. So it can't just be, oh, this person walked into my door today and has asked me for an emotional support animal. I don't have any prior care history to back this up. That would be an unethical time to write a letter. But if you are somebody who is providing mental health services to someone, you've got some history of care that you can reasonably use as evidence that you understand their disability and their need for the animal, then you can write the emotional support animal letter.
Yeah. Thank
If
you.
I can go ahead and add something as well, because this also comes up a lot. There isn't many restrictions on emotional support animals, and one thing that I see a lot often is like, oh, our insurance doesn't cover this breed. So where it is an emotional support animal, not only does the property's policies create an exception for it, the insurance also has to create an exception for the policy.
Correct. Any other questions?
I have another question.
Mhm.
This has come up a lot recently. More and more landlords are requiring our clients to get renter's insurance. Is that a fair housing issue, especially with people who have no income?
As long as they're asking everyone in all the units to get insurance, then it's not a housing issue. If they're only specifically asking your client for that type of insurance, then that would be a fair housing issue. That's a good question.
We've actually got a case right now with someone who may not have had rental insurance adequately explained to them because they have limited English proficiency. So that's another example that just came to mind where that sort of, requirement of rental insurance could potentially be a fair housing issue if like it's not been adequately explained. In this instance, the client is being charged for rental insurance and we don't know if they know that they're being charged because they don't have the rental insurance.
Do you know of any other cases that we're experiencing right now, Amy? That would
That's
go
the
with
only
homelessness?
one that I know of that's related to rental insurance specifically. We've had other issues with limited English proficiency clients who have, agreed to terms and conditions that weren't adequately explained to them at all. So that is definitely a big fair housing issue, and that can definitely still overlap with the homeless community if they do have something like a disability that impacts their understanding or perception. That could still impact them in a similar way too. So that's something we would want to keep an eye out for if you do know that you have a client who has issues where they need to have something explained to them differently or perhaps in a simplified English format. Keeping an eye out to make sure that those accessibility accommodations are being met is important.
Another case that I can think of is if you're seeing clients that are on the verge of getting an eviction for non-payment of rent, if they have a mental disability, please reach out to us. We can help facilitate getting a payment method set up or facilitate with a manager on how we can better arrange payments to be made. We do have a client right now where she is unfortunately on the verge. She already got the court eviction, so we are waiting to hear back from the attorneys. But in the meantime, it's a limbo. Where is she going to be in a homeless shelter tomorrow? Because this particular management organization did accept part of her voucher rent, but did not accept her rent. But they're still accepting rent of some sort for each month. So that's kind of why we're trying to fight that case, because they are taking rent from the voucher program, which means they are accepting rent of some sort, even though it's not her portion, it's of someone's portion to pay the rent for that unit. So that's another thing we want to be on the lookout as well for, is if you see a client facing that 30-day notice and they're saying it's because the client isn't paying their portion, are they accepting that voucher portion? And if they are, please contact us. We can help facilitate that as well.
I'd like to hear a little bit more too about reasonable accommodations.
Oh,
Support animal can be a reasonable accommodation.
mhm. Yeah.
But
Yeah, go ahead.
our clients have limited ability to read and understand leases, and so or notices that are put on their doors, and landlords are holding them to things that they don't really understand.
So they can put in, like Annie has mentioned, someone with limited English proficiency, whether that be they can't read or write English. If they have hearing disability, seeing disability, any type of that disability where they may need Braille, something put into a different language, we could, let's have that interactive process. And if they don't know what they're signing, they really should. I know that a lot of landlords will intimidate them into signing, saying you have to sign right now. We're trying to let our clients know you do not have to do that. If you have questions and you don't know what you're signing, do not sign. But if you have signed something you do not understand, definitely reach out to our office. If you have clients like that, reach out to our office, because they should be able to say, I need a reasonable accommodation to help me, even if it's not a subsidized housing complex. We can say, give us a reasonable accommodation so that we have more time to find the resources to get this interpreted for us so that we can understand it.
And a quick note, just to add, since, you know, some of you may be working with folks who have limited English proficiency but do speak English, asking for simplified English is also a very reasonable accommodation that I think is underutilized. A lot of people do have an understanding of the English language and can understand it if it's broken down into, you know, a less complex vocabulary. So that's something to consider too, especially if you're working with people who have like a learning disability.
What about using a child as a translator?
We don't suggest that. We normally advise people utilize a translation service 100%. That is something that if a place is receiving federal funds anyway, they should have that as an option. Now, there has been some iffiness with the language access stuff lately. Kara, if you want to say more about that part, you can. But just a general rule of thumb is avoiding using children as translators, if at all possible, or as interpreters.
I know there was an executive order put out. We had a note in it in one of our other trainings. Annie knows it more than I do, and I'm going to give it right back to her.
Okay, so the executive order specifically was about making English the official language of the United States. Up until this executive order existed, there actually wasn't an official language for the United States. There was a previously existing order from Clinton that opened up language access for people who received federal funding, that they had to provide this service to their clients. So this executive order that has just come in that makes English the official language can technically invalidate that existing executive order. So that's something that is still, as far as I understand, in flux. As far as we're concerned for enforcement for language access from a fair housing perspective, we're still assisting clients with that. A lot of it is through mediation and communication and trying to get the landlord to explain information better right now. So just keep that in mind that things might change as far as enforcement goes for language access. But yeah, that was pretty much the gist of what those executive orders did.
Thank you, Annie. Any other questions?
Who has to bear the cost for like a physical accommodation, like handrails in the tub,
Okay.
or if a ramp needs to be installed?
So for reasonable modifications, if it is a subsidized housing, they are required to make payment on that. They are required to pay for all the materials and the contractors to put it up if contractors need to be put up. If it is not federally subsidized, then the landlord could charge the tenant to put up that accommodation. They could also require the tenant to either put down a deposit to take that down at the end of their tenancy, or require them to pay for it to be taken down at the end of the tenancy if the landlord feels that it is not what they want up. So anytime, we always like to tell our clients, always ask for it in writing. It's the documentation. Make sure it's reasonable, and don't do anything without approval from the landlord first. Don't start building your ramp first. Don't start putting up grab bars first. Please wait for the landlord to come in and do that, because they know where certain things go and they can be responsible for it and not you. You guys have any advice for those of us who receive DOC funding as it pertains to the email? Annie, you got that one?
Yeah, so some general advice and then maybe some more specific advice. I know that the existing executive order that is related to gender identity does prohibit people currently who are receiving federal funding from using that kind of language in their grant applications and like reporting and things like that. So definitely be cautious on that end. Now, as far as it goes for practically acknowledging people, do your very best to meet people where they're at and respect their identities. We're still enforcing the Fair Housing Act as far as gender identity and sexual orientation is concerned. So if discrimination occurring based off of somebody's gender identity, we're still going to pursue that as discrimination right now. So just keep in mind, Fair Housing is still planning to enforce that normally, but keep an eye out for updates. Absolutely. Things are changing really quickly, especially with these executive orders. But right now, we are still assisting people who are facing discrimination based off of gender identity and sexual orientation.
Yes, thank you. We'd love, it's an open space, it's a safe space. This is where we want people to ask us these questions so that we can give the right information that can move on to the clients. Are there any other questions? I know disability is our biggest intake here right now, and it has been for years. Disability is the biggest one we see.
I know a lot of people are worried about the language. You know, we got a list of no words.
Mm-hmm.
People, as Sarah said in her note there, that we want to be compliant with what our grants say. Our money comes from the government. You know, the golden rule: whoever has the gold makes the rules.
Yeah.
But you know, there's a sense of the justice and the advocacy part of it. You know, we're in this field because we want to advocate for people. We want to see people live in a just society, and we just feel like there's so much at odds right now.
There's so much uncertainty right now, even in, we know the fair housing sector is in limbo as we speak. He cut all of our federal funding. So we are looking at options for funding. We just encourage people to keep advocating, keep raising awareness for it as we continue to do. And it just hopefully it gets easier, but right now we're in the hard times. And as far as using correct words or correct terminologies, like Annie said, try to be inclusive with all the languages you're speaking and talking to everyone. Be inclusive with everyone we're talking to. Yeah, we're not doing it on our documentation, but we can do it as people.
All right, these are our experts here. If anybody has scenarios, specific situations that you would like to bring up, this is your time to do it. If you would rather talk on mic, I can unmute you. Got a quiet group today.
I know they're so quiet. You said sometimes they're really chatty and no one wants to be chatty at all.
I'm gonna
And you unmute me, Nick Murphy.
there we go. There you go, Nick.
Hey, thank you so much. I appreciate it. I wanted to loop back around to the emotional support animal and specifically, you know, an emotional support or a service animal. And actually, you know, risk outing myself and make sure that we're not in violation of anything, because we got some feedback. We have tightened up our verbiage in our lease about emotional support animals. So I want to make sure that if it's okay, use ourselves as an example and see if you see anything wrong here.
Okay.
So when we ask for documentation or in advance of an emotional support animal or service animal, we ask for the tenant to provide documentation from the healthcare provider who must be licensed and have a physical office located in Kentucky, must have been treating the tenant for at least 30 days prior to the documentation. The documentation must be issued on their official letterhead that includes their up-to-date active license number, their office information, and their assertion of the tenant's legal or medical need for the accommodation. And we got all of that from other sources. Is anything that I just said
Yeah, I saw a
raise a
couple
red flag?
So limiting them to just Lexington is limiting where they can go for their doctors. Some people might have their doctors established where they lived before, like me. My primary care doctor's in Danville. So limiting my primary care doctor or whoever my healthcare professional to Lexington takes away, now you telling me I have to change my doctor that's been seeing me for 20 years that I want to go see, that I have to now move to because I live in Lexington here. That we can't do that. Yeah, you can't limit where they can get their doctor's note. You can say that they have to have a prior relationship with a tenant. So because a lot of times we have to also think in the mental health fields that now we see a lot of people going online for their mental health facilities. Like instead of going to the doctor, they're doing their Baptist Health online. So they're not always going to be seeing someone in Lexington. They might see someone in Winchester. They might see so we have to keep that open. So it can be a licensed professional in Kentucky.
It does say in Kentucky. I'm sorry.
Okay, yeah, just not basing it to one specific area in Kentucky.
Yeah, it doesn't. Yeah, I'm sorry. I'm in Louisville. It doesn't actually say in Louisville.
Okay.
It just says that they have to have a physical off. They have to have a physical office located in Kentucky. And the reason we delineated that is because we found people who were licensed in Kentucky have never been in Kentucky, stepped foot in Kentucky. And we also part of our logic was to protect folks against scammers online. Because I was having folks come to me and they've gone online and paid $75 for a letter that actually doesn't meet anyone's criteria.
Yes. Maybe not limiting them to have a base office in Lexington.
Well, I will say the requirement for a physical office in Kentucky is unlawful. If they are licensed to practice medicine in the state of Kentucky, even if they've never set foot in this state, they are legally licensed to practice medicine in the state of Kentucky or whatever their practice is. They don't have to be a medical doctor either. But the requirement that they do have a license to practice in the state is fine, but the physical geographic requirement is unlawful.
Okay, so if I remove the physical office in Kentucky,
Yeah.
we would be okay otherwise?
I have some concerns about the 30-day requirement. I think having the specific language is a problem. Saying that they have a prior history of care should be fine.
Yes, that's what I was
Okay. Prior history of care. Now, just I guess, I don't know if, well, actually, no, lawful or, okay, I'm sorry.
No, you're fine.
I'm rambling here. So
You're
prior
fine.
history of care, just taking some notes here to kind of affect changes.
And that's a perfect example of the kind of stuff that we want you all to ask us. Like, this is the place to ask those questions where you're not sure, like maybe we're not in compliance and we can make a change. Like we're not going to suddenly start coming after Nick because they have this existing policy. He's affecting change because he had the opportunity to ask the question.
Yeah.
Okay. And then part of our other policy is that, and I feel like you spoke to this a little bit, is that once an animal comes on site, that they must, abide by local and state laws. So license, registration, spay, neutered, keep animals up to date on vaccinations, leash laws, and submit as needed documentation. I'm sorry?
Go ahead.
Go ahead, sir.
And submitting, whenever we do lease renewals, necessary documentation to show that they have a means to provide proper food, veterinary care, and pest control, like fleas, ticks, heartworm.
I will let you know that you can't put any restrictions. You can't tell them they have to neuter their pets. You can't tell them anything like that. Now, you can require the veterinary records and the doctor's note. That's all you can do.
Well, I'm not asking them to neuter. I'm asking them to follow state law.
No, it's federal law. So the federal law will supersede the state law. We will fight.
So we
will fight that on the federal level.
So we would need to remove the abide by local and state laws.
I
Yeah,
think,
because-
well, I think that still abiding by laws like a leash
Yes.
ordinance is perfectly acceptable. As far as I know, there isn't any sort of law that requires a spay or neuter. That is something that you all can't require for emotional support animals, but
Yeah, and
things
again, we're
like the
not-
leash
yeah.
ordinances and picking up after the animal is perfectly acceptable.
Okay.
Holding them
Okay.
accountable to like take care of the animal, keeping them on a leash, cleaning up after them, not damaging the property, that is all within your right.
Okay. Awesome.
And when you do your policy, Nick, you can have it on a letterhead, like you had said earlier. It needs to be on their letterhead with their license number. You can ask in that policy when requesting an accommodation for an emotional support animal, please provide this letter, your vaccination, and your license.
Okay.
Those are the three main things that we see that are tickets to, yes, these are things that landlords are definitely allowed to do, because you should be able to ask for the vaccinations and the licensure for a pet as well. We're just adding that letter in for that emotional support animal.
Awesome.
And just for clarity, by license, she would mean like the city license,
Yeah.
like Lexington requires all animals
Correct.
to be licensed, that sort of license specific.
Yeah.
All right. Awesome. Well, I appreciate helping me kind of amend this and clean this up a little bit. Thank you.
Yeah, anytime you have any questions, Nick, just reach out to us.
Absolutely.
Thank you.
And that goes for everybody. If you have a policy at your organization that you're not sure about whether it's in compliance or not, we are more than happy to review those for you anytime.
Yeah,
Myself
walk
included.
through the steps to kind of make sure you're in compliance with it and still get the things that you're needing out of from your organization as well.
Are there other scenarios or issues that your clients face specifically that you want to run by our experts while we have them here?
So quiet today.
No. Doesn't look like anybody else has anything.
I unmuted myself, Laura. It's not actually a question, but Carrie, I've actually worked with you doing some of the
I thought you were one of
testing.
my testers. I was like, I purposely
Yeah.
missed my
And I
tester.
just want you to know it has been, I did it prior to you. I cannot remember his name now for the life
Drew.
of me. Drew. I did it with Drew for a little while and then with you. And I just want you to know it has been one of the most eye-opening experiences.
Thank you, Nick. I appreciate it. I got flung into the role and it's been like a year's worth of madness and I'm just now figuring it out. I just now have a grip on it, Nick. So be on the lookout for tester newsletters and all that jazz coming up.
Awesome. Yeah, that's something I think everybody should experience. It is,
Shout out to Nick because it is good work.
well, thank you.
About that a little bit.
Do what?
Tell us about the testers.
So the testers, what we do, I kind of did a little brief synopsis of it. So what I would do, like Nick can kind of jump in whenever he feels to give his side of it, but I do rental tests and sales tests and lending tests, and I'll assign 2 testers, what we call a protected tester and a controlled tester. And our protected tester is going to be someone under that Fair Housing Act that's protected under the law. And I will send them to a potential rental agency or apartment complex. And say it's somebody with a disability. So I will send them in and I will just have them say, I'm here, I'm looking for a unit. Can you just show me around? And now we want that landlord or potential leasing agent to show the person with the disabilities the same things they show the control tester, all the facilities, all the common use areas, different types of units, not just the ADA unit. We want them to show 2-bedroom units that are regular units if that's what they want. If they say, oh, it's an elevator site and I want to be on the 5th floor, don't tell them they need to be at the bottom of, at the bottom. So then we would send that control tester in who doesn't have the disability, and hopefully they got the same answers that our disabled person got. And then we just kind of compare their narratives. There's a bunch of questions that go in with it, right, Nick? And you just kind of are looking for, is everybody getting told the same rent, the same security deposit? How were they just talked to and treated? Were they given those different terms and conditions? And then from there, I kind of read over those tester narratives and decide if that complex needs to be investigated further because I saw some discrepancies on how people were being treated, or the complex did great and it doesn't support anything and I just move on. Nick, what do you have to add to that as an experienced tester? What's it like on your end?
Well, it's when I first started doing it and I was trying to explain it to my wife and children, I described it. I said it's kind of like a James Bond kind of situation. I said they send me this like fake identity and I have a fake family and a fake job. And I said, so there's a part of that that's kind of like entertaining. That's kind of an interesting component. I've never had a job where I had a fake ID.
Yeah.
So that's kind of the fun part. But yeah, it really is just kind of getting folks on the phone. Half the battle is just getting anyone to answer sometimes, but getting folks on the phone and just trying to ask a lot of questions without sounding like you're too scripted. You just hear a lot of stuff, and I've been able to kind of speak to case managers and clients about some of the struggles that I know folks are facing after having these conversations, hearing about fees and kind of add-on charges and understandings in leases that completely aren't legal, that I'm just hearing more and more about and we're experiencing elsewhere. So it's just been a really eye-opening experience. And sometimes though, I'd say probably like 50% of the time, like I don't experience anything that seems horrible, but when you recognize the bad experiences, it's pretty outstanding.
Yeah, it is. It is. And by the way, this is a paid opportunity. So anybody listening, you can hit us up on our website and we do pay a stipend compensation for certain types of tests. We have, like Nick said, we've been doing mostly phone call tests, but this year we're going to move into some in-person tests. And so we pay different for in-person tests. We pay different for phone call. We pay even more for sales and lending tests. So you can earn up to $100 per test. It is very fun. I did one just a few weeks back. I did the mortgage lending test and just kind of got insight on how new home buyers experience that from a banker and the things that all the information you're going to get. And, some of the tests, Nick, I'll give you some information about numbers we've seen. We ran some language access tests and we couldn't really focus on that barrier between English and other languages. So we mostly focused on seeing disability and hearing disabilities. And I did 20 subsidized complexes, and I think about 15 of them did not have a policy in place to accommodate people with issues with seeing. We did reasonable modification and accommodation ones. We saw maybe 2 or 3 that weren't willing to give someone a parking spot. And then we did different rental ones, which we look at criminal background, which is something we talked about today. We actually found a handful of complexes saying they're not going to rent to someone just because they have an arrest record. That's an unlawful baked-in policy that we're going to talk to them about. So these are the types of things that our testers are finding for us that are still happening. And at this point in time, we would have hoped this was not happening still, but it still happens. And so that's people like Nick that are invaluable to our organization. So yeah, anybody who wants to do it should sign up for it. It's great.
And if you want to sign up, you can go to our website and fill out our volunteer application, and Carrie will review it and get back to you.
That's what I was going to ask is how do people do that?
Yes, go to our website and fill out a form. I have about 5 volunteers in there now. We're getting ready to start our new grant year, so I'm holding off on new trainings because I'm working on revamping, like I told Nick just a minute ago, revamping that testing. So there's going to be new documents and things like that coming out. So kind of holding off on anything new, but if you fill it out, you will definitely get training and your first test, and it's fun.
All right, anything else we need to bring up today? All right, well, to our presenters, do you have anything else that has come to mind that you feel like would be helpful for us?
Annie seems more of our intake than I do. Do you have anything to add, Annie?
Not specifically, but please remember us as a resource for your clients. Absolutely. Even if you think that it's something that might not be fair housing, I know myself and Noelle are both perfectly happy to have conversations with people, help them figure out what it is that they need. And if it's not our services, then we help them get in touch with someone who can help them. So absolutely, anyone you think has anything even remotely relevant to fair housing, please don't hesitate to send them our way so that way we can give them the help that they need.
And I will put in a plug for a Fair Housing Council as well, because anytime I've ever reached out to you all, you have been so quick about getting me a response. So I appreciate you all just being expediting your contact with us, and appreciate everything that you do.
Thank you. We appreciate you guys too.
Yeah, and something just to, sorry, Carrie, don't mean to
Go
cut
ahead.
you off. Just keep in mind, if you all do have a client that you refer to us, it does help us kind of make sure to keep an eye on them and know who we can talk to about their case if you let them know or let us know that you're referring from your coalition or from one of your organizations.
All right, well, everybody's got your contact information now. Thank you so much for giving us some time today. And if people have questions later on, they think, oh, I wish I had asked this, or I had brought up this situation, then they know how to reach out to you,
Yep, absolutely.
get help down the road. All right, and don't forget, everybody who's on the session today, you will get a link to complete a survey for the coalition. Please fill that out. And then if you think there's information on here that people at your agency might benefit from, check back on the coalition's website in a few days, and there will be a recording of this. Or if there's something you just want to go back and listen to again and make sure that you heard something correctly, you can do that. All right, thanks everybody.
Thank you.
Thank you, everyone.